All right, in this video, we're going to talk about bony contours of the inferior border of the clavicle and coracoid process. And we'll probably talk about some other things also. But in general, like how do we get this area from a soft tissue standpoint to free up, okay? So the first thing is the inferior bony contour of the clavicle, all right? So you have PEC Major that attaches onto here, and then you just have a lot of potential for fascial restriction along that border. You also have subclavius muscle underneath there as well. That was coming at a loss. I was coming at a loss for words for that. But so I start medial on the clavicle, and then I will work along the clavicle. And I'll kind of use two fingers. The first finger is more of almost like a dummy finger where I'm just trying to get the depth that I want to get. And then I'm actually mobilizing with my trail finger as I work along that bony contour. And it is really tight and restricted there. So anytime you come to a spot that feels restricted, you just want to hang out there, and then you can apply your cascade of techniques from the video that we went over for soft tissue mobilization cascade of techniques. So I could just stay there, she could breathe. I could also apply a shortening or lengthening premise, but when I have a dummy finger, I can't really do as much shortening or lengthening. It's more of just a lengthening technique. I can also apply an unlocking spiral to where I am going into pronation, supination, right? And then you can watch the cascade of technique video to do kind of experiment with some of the other options that you have there. But with the bony contour specifically, I'm just working along that. And ideally, I would be able to work on those soft tissues to where they would be nice and pliable and springy all the way out to the lateral border, or to the lateral portion of the clavicle. The other thing I want to talk about in this video is the coracoid process, right? So the coracoid process is the anterior structure that you can palpate on the scapula, right? And what attaches to the coracoid process? PEC minor. All right, just gave you a little time to think about it. But so PEC minor attaches to the coracoid process. So coracoid process is here. PEC minor kind of comes down and fans out and attaches to ribs 3, 4, and 5, okay? But the thing that I'm more interested for this video is the bony contour, or the more superior arch portion above that coracoid process, because it can get really bound down to the inferior portion of the clavicle and the glenohumeral area as well, okay? Or the humeral head as well. In addition to that, the acromion process. So like all of this can just get all bound together, okay? So I start medial to that coracoid process, and then I will scoop around. So as we scoop around, we come right around that coracoid process. And I'm finding a hard infill, and then she can just breathe into that. And out, good. And again, breathe. And out. All right. And it, on so many people that have upper quadrant shoulder girdle issues, it's going to be really restricted in there and tender. And so you have to come in with soft hands, sink in, and then just really imagine that you're scooping around that bony prominence. So essentially you're scooping right around that finger to try and free that area up so that the scapula can sit back in a better overall position and distract away from some of the restrictions anteriorly.